Now, we are going into the last program of today's session, and this is the debate among the people. And as you can see, the Dr. Wakita from the National Health Crisis Management Institute is the facilitator, and also the Dr. Makita from the Tokyo ICDC chairperson, and also the MHLW Infectious Disease Management Office, Dr. Sakoi, and also Tokyo Metropolitan Government, the Health Bureau, Mr. Narita. These are the debate panelists, and the two chairpersons are going to facilitate the discussion. Okay, go ahead, please. Okay, now, thank you very much. I am calling it a gist, but I am the deputy advisor, and the Wakita is speaking. Tokyo ICDC Forum has been hosted over 2 days, as you can see, and this is the very last session to open the floor for the debate for the infectious disease countermeasures and what kind of roles we are to play. That will be the themes. And we invited from MHW the Dr. Sakoi and also Dr. Narita, invited from the Tokyo Metropolitan Government, and we, the facilitators, are also to speak about the theme. And as we discussed in the earlier sessions, the COVID-19 pandemic was the major challenge for us. And through the experiences in Japan and also in Tokyo Metropolitan Government, we have experienced the major change and shift in our countermeasures in those infectious diseases. We have done whatever we could do during the pandemic, but we need to also get prepared for the next pandemic or next outbreak to be able to counter with the situation with a better approach, and we need the system to build up. So from the various kind of perspectives, we are going to have a discussion on that particular point, so we are looking forward to it. And now that I would like to invite all the doctors and who are going to explain the organization of each institution they are working. And in the first place, the Cabinet Agency for Infectious Disease Crisis Management, CAISM, the Dr. Sakoi is going to talk about the how to manage. And okay, then thank you very much for your introduction. And my name is Sakoi, and since the time is limited, so I'm going to spend the next 5 minutes for my part of the presentation. And as you can see, and you will be able to refer to the information later, but and I'm not going to go into the details because I don't have enough to go over. But if you look at the overall chronological order, as you can see, the 1, 2, 3, 4, those numbers are the ones in the early phase of the pandemic, and then we ended with the designation of the class 5 in infectious disease. And considering those phases, we needed to consider the countermeasures. And what I have to focus upon is this chart. You see, and we have reshuffled of the organizational system, and also if you look at the blue one under the arm of the Prime Minister, and we have actually built up the countermeasure task force, and you can see. But the difficulty of pandemic, and the most important thing we need to deal with during the pandemic is to unite ourselves in the society. That's the reason why in the middle you can see as the government, and the responsibility of the Prime Minister, overall organizations and the government bureaus had to be mobilized. So we didn't have this luxury in the middle of the pandemic. The Prime Minister then did his best, but we didn't have any preparedness, including a training, in order to solicit, in order to unite all of the MHLW and its bureaus. It was very difficult to do so, and therefore that's the reason why after the pandemic we set up this system, which is the crisis management agency of the infections. And there are two things I need to highlight. And then we clarified that we are going to mobilize the overall government, but still, MHW is going to deploy the infectious disease countermeasures. So in order to have them work together, then what we need to do is follows. And my own position is symbolic, as you can see in the middle of the chart. You can see within this agency, I have been assigned as the countermeasure, the officials, and at the same time as the specialist officials, and then I've been presiding over all of the functions. And this is something we need to do, and it's very important to reflect. And also another thing is that, and you can see that we've been dealing with the basic researches and as the with the NI National Infectious Disease Institute, and we used to have the organization that was very strong at the clinical infections, and these two actually was considered as a part of the CDC, which was equipped with the scientific knowledge and information, and that was the mechanism where we needed to solicit all of the expertise and specialists. So they have been incorporated in a JIHS that's been newly established, and which is governed and led by the MHLW, and including their clinical study conduct. That's the organization we have established based upon the learning through the corona pandemic, COVID-19. And this is just a brief introduction on the pandemic countermeasures and how we approach as the government. These are the action plans. Now, we used to have the action plan in the past, but it's hard to understand. But you see the new flus and so forth. That means that the new infectious disease that will induce the pandemic. So in that sense, we call it the flus and so forth. So we've got the pulmonary infectious diseases but we have struggled most with the COVID-19. We have never exposed as the human beings. So I think, and this is the not just the name of the law, but for the pandemic infections, the action plans been laid out under this new law. And as you can see, we have learned quite a lot, but repetitively, and then. And once we contain the situation, we should be learning to reflect. So based upon those learnings, we have established those organizations. And the two other slides is, it is very important to get ourselves trained through the peacetime. And that's got to be done by the autonomous bodies and also the governments. And also globally, we need to liaise with the organizational institutions and the ones in the UK and US, which are actually doing, and we've been tying up with the research institutes, and that is the role of the government that needs to play. That is all for me. Okay, thank you very much. That was very illustrative. Thank you very much for your explanation. And Dr. Wakita, can you elaborate the Japanese JIHS, and then can you introduce what the organization is all about? Okay. And then Japan Institute for Health Security, JIHS, its roles and responsibilities are going to be explained from here. And as introduced, there you can see, together with NIID and NCGM, they got merged in April last year and was established as JIHS. And as you can see, it's based upon the challenges and the learnings through the COVID-19 pandemic, because in the clinical setting, we needed to develop more talents and capabilities to be able to cope with the pandemic, and also the health and hygiene, public health responses, and also the testings have to be better prepared, even if you have the high demand of the testing, and also the vaccine, diagnostics, and then we were late in developing the domestic brands, and then we needed to build it up once again, and also the risk communication interactively had to be done in order to get ourselves information and trusted. And in 2020, in June, the Prime Minister Kishida announced this particular organization establishment, and then it was actually made into law. And you can see in this chart, in those red bags, on the right hand side is a JIHSGs, we call it. And those are rules in place from the government, let's say, in accordance with the policy needs, and we are to supply the scientific knowledge and information that are required by the governing body, and we are to supply it. That is the biggest role we need to play. And you can see this is the new organization chart at the bottom. You can see these the business units, and below there we have the board to govern, and up at the top. And you can see mission is to contribute to the secure society, and in terms of vision, the world top level infectious disease science center to be established in order to prepare and provide the information on the public health. Now is the latest knowledge, and the biggest one is the disease intelligence. Second, in research, development, and innovation. Third is comprehensive medical care. And last is the human resources development and international cooperation. These are four pillars, and the most important is the infectious disease intelligence activities. And MHW is the lead, and in case of the pandemic, and when they make the decision, they do need the information to rationalize the decision. So the various kind of infectious disease information will have to be collected and assessed and translated and provided to their use. So this is something to liaise between the experts and also the government bureaus. And as you can see on the right, on an indicator basis, was the information collection measures, and also through the event-based surveillance being done through the open information. And also, you can see these are the research system, and then you can see infections have been researched in with various kind of virus or microorganisms, or fungus. But what is important is to have the matrix and to be able to utilize whatever the information is needed in case of the pandemic or outbreak. And another system of the research is as follows. On the right hand, from the basic research to discover the disease, and we need to build up the consistent development. And in the clinical study, we have had some reflections. In the peacetime, we needed to develop this kind of network. Now it's called ICROWN in order to identify the emerging infections, and that's good to be in the research through this network. And already it's been established in 35 prefectures and in 39 sites. So whatever happens, we'll be able to rely on this network system. And also, as you can see, these are the clinical system where you are able to provide the advanced treatment. And you can see from the NID, and we used to provide the kit for testing, but in each region, the testing network is to be established in order to enhance the capacity for the testing. That's what we are aiming for. And also the liaison with the regional, public health authorities in order to built in our responsibility to share between those organizations. And as you can see, we are tying up with the various kind of organizations across the world, including the WHO, CDC. Those are the expert institutions, as you know. And the last one is the risk communication from Gs. And then it is not just through the government organizations, but we need to deliver the various kind of knowledge and intelligence, and in order to build up the consensus between the policy makers and also the population. So this is my summary. GIHS was established as the organization of the expert specialists on the infection and its crisis management. And we are going to be ready for various kind of infections. And in order for that purpose, we are going to continuously tap with various kind of organizations. Thank you very much. Then we would like to invite the Dr. Narita for the Tokyo Metropolitan Government's efforts. And from my side, I am going to share our activities and efforts to manage the infection crisis. And you can see these are the image of the organization of the health and crisis management of Tokyo Metropolitan Government. In order to get the advice, as you can see, the emergency medicine and other members are invited for the Tokyo IDCD expert board. And in order to deploy the effective countermeasures, Tokyo ICDC was established in back in 2020 October, and the details will be explained about the Tokyo ICD by Dr. Kaku. But with these two wheels and for the overall infectious diseases, we are preparing to cope with the situation whenever it happens. And as you can see, 2 years ago in March, we have planned out this prevention countermeasures in Tokyo metropolitan area. And you can see we have prepared the countermeasures to prevent the prevalence or spread of the infectious disease. And based upon our learning from the COVID-19 pandemic, that we have fulfilled the organization to cope with the pandemic, and also considering the uniqueness of Tokyo metropolitan office, and then we have updated our past plan. And in the prevention countermeasures, you can see at the time then emergent the infection. And at the time of the advent or emergency, you can see those are the sites and the number of beds that will become available in case of the new pandemic or a new infectious disease epidemic. And then depending upon the trend and how large it is. In the peacetime, you can see the clinics or hospitals are actually signed up the contract together with us in case of the emergency to be able to achieve those availability of the sites and the hospitals. And as you can see, as of last year, 1st of October, we have achieved all the target figures. And for the next, getting prepared for the next pandemic, we to minimize the impact upon the economy. That's the reason why new flu and others infectious disease countermeasures have been renewed to get ready. And during the peacetime, we have planned out the training and the practice, and also to have the communication plan between the government and also the clinics. And in order to have the initial action in case of the emergency. And you can see these are the points of the actual action plan that will have to be practiced by the Tokyo metropolitan government and population, and by embracing the communication with each individual members of the Tokyo metropolitan government and also the Tokyo metropolitan area. So please refer to it. You have that in your brochure. And to build up the health and public health network, especially in Asia, in major cities, we have the common agenda. So we are purporting to tie up with those cities to be able to build up the network among the specialists and also to conduct the research and studies. So it's been started from the 2025. And Tokyo ICDC activities are expanded in Europe and the US, where we have visited to actually monitor what they are doing. And we have been seeing the advanced activities. And also the Thai Mahidol University training is joined by the doctors, physicians, and nurses. And then in order to build up the human network of those specialists. By building up this kind of network to be able to gain our understanding on the public health management, it is critically important. So that is all for the efforts being made by the Tokyo Metropolitan Government. Initially, the COVID-19 was an unknown disease, and we have never seen the challenges as before. But now, thanks to the face-to-face communication, we've been supported. So for the next pandemic or infectious disease, that we would like to continue our efforts to be able to cope with the next situation. Thank you very much.
Narita-san, thank you very much. And Kaku is going to talk about the role and activities of the Tokyo ICDC. Tokyo ICDC are constituted by the experts of various areas. So it is the intelligence network, virtual intelligence network of various experts. And expert giving the expert opinions and receiving advices and putting those into actions. And there are 9 teams depending on the speciality. And we have the external advisor who give objective advices leveraging their expertise. And furthermore, we have a task force which considers specific items regarding infections. And this is the expert board and the task force. And for the sequel, genome analysis, and the syphilis and AMR and One Health. And we leverage the online meeting and to receive opinions from the expert of various areas. And this is the Tokyo IDCD Expert Board activities and the role and also the mission of each board. And briefly, I would like to elaborate on the activities of some team. The two-way risk communication, today's the theme. And we have board members who are specialized in risk communication and to promote the two-way communication and conducting the questionnaire against the Tokyo residents. And also, there is the infectious control team, and they have created various handbooks that could be utilized in daily lives. And on the right, and the handbook for the infectious disease prevention, and also the infectious countermeasure handbook for the child nursery. And sequel of COVID-19, responding to it, and we have conducted the 4 online seminars since the 2022 July, and for the companies and teachers and caregivers and also the general residents. And we have created the portal site for After Effect launched already so that we can provide information to the Tokyo residents and also the HCPs and about the after effect of the COVID-19. Yesterday and today, and we are having the Tokyo ICDC Forum by 2024, and sports and infection and also disaster infection for that's the theme for 2025, and 2026 theme is the infectious disease and child. And we are providing the seminars for general public, and also the forum consisted of the expert. As Narita-san said earlier, we are cooperating with the other countries' network, the institution to obtain information by visiting those institutions in person. And as Dr. Wakita said earlier, we need to reinforce the intelligence, and we need to support the infectious disease prevention measures, and we need to improve the resilience of the society and to respond to the society-wide infectious diseases. And there are 90 expert virtual network organization, which is Tokyo ICDC's, and that is a characteristic of our team. And then Tokyo ICDC Secretariat, Tokyo Metropolitan Government Bureau of Health and Medical Care, and Tokyo ICDC. We are conducting joint activities and providing support each other. In Osaka, Kyoto Prefecture, in other prefectures are thinking about constructing the regional CDC, and this is the virtual model network model that could be a reference for other prefectures. From here on, I'd like to take questions from the floor, but first of all, 3 presenters, please, professors and doctors, I'd like to ask some questions. Dr. Sakoi. And in September 1st of 2023, it was established, and last year, 2025, GIS has been established. And it was due to COVID-19 that very impactful infectious diseases that led to the establishment of these new agencies. So, centering around the cabinet agency and GIS, how are you going to collaborate going forward, and how the meeting is going to be conducted, and how you're going to collaborate, and how you're going to communicate each other? How are you going to lead initiatives? And Dr. Sakoi, can you talk about it from your perspective? Thank you very much for the question. How are we going to lead it? And well, it is rather a general question. It's not easy to answer specifically. However, I wanted to feature this slide of organizational structure. And there is the chart with the block of institution and teams. And this cabinet agency for infectious disease crisis management has been established. And when it's the crisis for the nation and for the citizen, it has been established already, and to respond the Hanshin Awaji earthquake, because this is a country with a lot of disasters, and we had the national crisis event. So we had the team to respond to it. However, this was a pandemic. And the most impactful thing was that the team with the scientist and expert, the knowledge and experiences of scientists and expert, and we need to leverage the information from outside and to find out what kind of disease that is and what kind of infection that is. So we don't know because it is new, and it is not. It is different from the disaster and the crisis event that we have had in the past. So we need to collaborate with the existing crisis management agencies. So thinking about that development and past history, we have there was establishment GIS to leverage the specialist knowledge, and there is a meaning to connect with the clinical department and also the basic research. And as far as I know, there's only 2 countries which has a connection between basic research and also the clinical department. And my agency and also the GIS is the good example. And in the clinical department, you can collect information, and then it could be applied to the treatment based on the specific specialist knowledge. And that's the only GIS can do it and have a capacity. And this is a new development in the world, and as a first case. And the important thing is speed, agility, and knowing the infectious diseases, and then take action speedily, leveraging the overseas information. And operating network smoothly is not about human resources, and we need to rely on the operability, and we need training, education, and we need to know the counterpart, and we need to become friends. And when we first meet, when the pandemic happens, it's too late, right? And we need to be friends and acquaintances before something happens, so that we can rely on each other and ask requests when something happens. Yes, thank you very much. Like you said earlier, and this is Japan version GIS. And the reason is that the clinical department and also the research department are combined into one institution. So the US CDC doesn't have a clinical department. So it is a first trial, and this is the first model in the world. So we need this basic research, and the research clinical department, which has the expert scientific knowledges, and also the combining with the cabinet agency, that we could overcome the infectious diseases and work on the prevention of the infectious diseases. And GES has a lot of expectation and clinical and researches and the risk communication, and also the collaboration with other stakeholders such as the regional communities and also the prefectures. And you have a lot of roles, and it was right after the establishment. There might be a lot of challenges you may have found so far. So can you share your thoughts? Like Dr. Sakoi said earlier, yes, and there is a high expectation towards GES, I understand it. So to identify the root cause of the infectious diseases and the pathogen and also the infectious disease stain research is something that we have been conducting. But what's lacking is that the functions, which is called the infectious disease intelligence. So that was a weakness. And we are collecting the infectious disease information and analyze it, and then provide the correct information. And that's the important role that we have. But in the previous, we had the public information. We have out of 327 are the expert in the previous entities, and then they have been working on the public health and also the crisis management. They were doing it all. However, we need to enrich those functions, and that is the why the national government allows GS to increase the number of staffs. And as my slide 3 says, that we can do the researches and analyze it, and we can provide information to the cabinet agency and also the national government. And moreover, that we have a clinical trial department, and we have combined in the GES, and that's another benefit. And this is something we learned from the COVID-19.
So when the COVID began, the clinician was extremely busy with their daily activity. So the measurement and the R&D and collection of information was really challenging for them during that period. So in order to cover that part, so we got to organization to combine, and it is not necessary during the pandemic period. So we are going to construct a network to respond to that. And Sakoi-san had talked about the response. And this is an organization of our organization, and it was a small organization in the past. So it was we were flexible because it was small, and we were able to respond speedily. However, our organization grew. So the governance and the instruction and how we're going to deal in a speedy manner is something that is a challenge for us in the future. Thank you very much. So in this venue, I think the previous infection center members are here, and also epidemiology, public health, and also AMR specialists are there in Tokyo. So using those knowledge and learnings, and also together with the clinicians' knowledge, we hope that we can aggregate those information, and so that we can collaborate with the infectious disease crisis management. So I think you have shown a slide before. So in case of emergency, so in terms of pandemic, I hope you can bring up the slide again. So number 10 or 11? Yes. So just before that, So this is a crisis management related function, and I just want to know, so which of the function are you going to establish first, together with the global organization? Yes, can you move on to page 11? So under the law, so surveillance has been conducted, and on the left-hand side, depending on the infection will be communicated to us, and the dashboard information can be referred by the viewer. And at the time of the pandemic, people could start collecting information together with open sources. And also, global network could be utilized in order to gather information. And our government and our ministry has been structured to collect information. So we're going to utilize all of the organization to collect information. And this has been since 2019. And we heard that around the New Year holiday in 2019 to 20 that something was happening in China. So if we were able to move faster and then start collecting the information earlier, maybe we were able to respond much better. So currently, we are trying hard to collaborate with the global organization to support that. This is a question to Dr. Narita. So Tokyo is a capital of Japan, and it is the largest city in Japan. So I think there's a challenge. And I think you have mentioned about the action plan. And I think the Tokyo ICDC and the Health Bureau and GS, and together with the other organizations have been collaborating to push forward this activity. And the policy, including risk communication, along COVID, those challenges has been dealt with in your organization. So I just want to know how you're going to collaborate with the national government, with your organization. I think it's ongoing, but I just want to know how are you going to further promote the activities? Thank you very much for your question. So, yes, as I said, we are in capital. We have 40 million people living in Tokyo, and 650 hospitals are there, and we have a lot of large company residing in Tokyo. And there's also a lot of visitors coming here to visit in Tokyo, so we have to respond agilely. And I think Dr. Sakai should have been putting a close eye on this. And together with our expert support, we will conduct surveillance. And also we're going to prevent and take necessary action based on our action plan so that we can respond to emergency situation. And we will also like to provide education and training. And also we are improving our process. And currently, Tokyo is doing this. Can you move on to page 25? So we have Tokyo ICDC in our place. So all the experts will give us support to us. And also we have the strategy board, which is written on the right-hand side. So the emergent and infectious disease expert will be informed about the current information, and that is reflected to Tokyo's new policy. And during the pandemic, we were collecting this information, and we had a necessary expert meeting to come up with good advice. So Dr. Omagari, Nishida, and we had a lot of experts sitting in that committee so that we were able to effectively give out information to our resident. And what was necessary is that we should continue this process even during the peacetime. Of course, ICDC will do this, but also the strategy board will also be held so that we can have effective communication. Also, we will also have another meeting so that we can respond to the summertime infectious disease and others. And the governor has been having a press conference every Friday. She is making sure that the infection disease-related information will be given out every time. We have been dealing more than those information, but there's so many items that we have covered, so I cannot cover everything here. But we will make sure that we will have effective communication in a daily basis so that we can promote this activity. And we're talking about the medical EX, and I was wondering whether it was truly necessary during the COVID pandemic time. And however, medical EDX have served a big role during the pandemic. We got information from the resident, and we utilized the HERSET system to give back information to the resident. And currently, we're dispatching our expert to Taiwan, and we hope that we can build a stronger medical EX so that we can deliver information in a more speedy basis. I was talking with Dr. Sakoda, and I hope that we could share necessary information with MHLW and other government member. Thank you very much. So can you bring up the slide again? So I have been working with other experts in ICDC, and in the clinical setting, and the doctors in the strategy board is really critical. And as Dr. Narita said, we have been holding this strategy board meeting every month to communicate about the influenza situation and how the trend is going to move. So we are having our risk communicator to be involved in the strategy board member to share necessary information. So as Dr. Wakita said, so the clinical doctors and the risk communicate expert and the assessment sector, all these stakeholders are needed to be involved. And currently, our Osaka CDC is currently considered to be launched, and also I heard that Kyoto is also preparing to launch their ICDC. So this is a question to Dr. Wakita and Dr. Omakari. So I think the metropolitan area must have a lot of challenge, and in the big cities, Paris, New York, London as well. In big cities, if we are going to come up with a organization which we could talk about these risk communication. So, Dr. Sakoda, I think there's specific issue for the big city, but do you think that big city has to have this kind of organization?
I think this is the same in many other capitals of other countries, and especially, there is a difficulty to take the countermeasure in the major cities like us. And how to face the pandemic in the metropolitan area like the one we are living, and Tokyo has done it, and they have been doing with all might and force. But where the resources of the country, or maybe the sort of support or collaboration with the country, the government is very much needed. And also, there's something tricky about is. This can be said to many other capital cities, but you see let's say the specialty expertise, they are actually all centered in the capitals, and so let's say autonomous bodies have their own autonomous government right, but apart from the local government, their public health research institutes. As you know, Tokyo Metropolitan Government has got a lot of academia and also the research institutes uniquely, and therefore what we can tie with the local authorities and also the metropolitan the institute and the research facilities. That's something we need to consider. And because at the time of the outbreak or pandemic, you really have to make every effort, and then always we have to use a mind in the utmost difficulties, and it's not going to be in the textbook, and so maybe you would have to consider how to share the roles, and that'll be very much asked in the capital cities like us, and we need to collaborate with the government at the same time, and we would have to have the trustful relationship to be able to enable it. Okay, Dr. Wakita, what do you think? Thank you very much. I think the liaison with the local government, that'll be very important, because at the time of the COVID-19 pandemic, it was very important to know what was happening in those local areas and the rural areas. And we have conducted the advisory boards every week, but at the same time, we had the kind of the behind the scene, the specialist meeting every day, and where we invited the specialists in those rural or local regions to be able to report us back and to be able to learn from them quite a lot. And how we can enhance the countermeasure capacity of regions will be very important. It's something to do with the infectious disease expert talents should be developed as well. And NHD has been having the talent development courses which have been joined by many of the experts who are currently working in the regions. And also after we became JITs, and we have started a new training scheme. And especially this is a training for their governmental members, and we have already started the crisis management for infectious disease, and together with the specialties and also versus the crisis management experts, both of them are have to be developed as capabilities and talents in the regions. And with that, we'll be able to build up a kind of regional CDC to be able to cope best with the infectious disease, the outbreak. Okay, and we have heard a lot of comments from the specialist panelists, but we got a lot of specialists in the venue and also on the web. So, and I would like to listen to your voices as well, and questions or comments if you ever have. Please raise your hand. And a microphone, please. And a question, Anna Kaku from the Self-Defense Force Medical School, and I just would like to touch upon the WHO. U.S. withdrew from WHO under the circumstances, and we will be required to play many other roles. In May, there we signed off the pandemic treaty, and inside Japan, we haven't ratified it, although. And in order to make it effective, in many senses, Japan will have to show our leadership under this new scheme, and under the circumstances, what kind of roles to be played by the country and the government. Can you tell us what kind of roles we can play? Well, WHO is really in an austere situation, and under the circumstances, what kind of roles we can play as Japan? That is your question, right? And I think probably Dr. Sako is the best person to be able to respond to this question. What do you think? Or as the country Japan, we have a stance, and I think the infectious disease countermeasure is being dealt with by the experts here, and you can see smallpox and also the many other infectious diseases have been dealt with, and we have emphasized them, reinforced them. So we have had several summit meetings. Without the global network, we won't be able to have the effective infectious countermeasures. That is the overall assumption. So the efforts to be made have got the maximum value to be able to offer. And under the circumstances, the U.S. withdrawal was really regretful, but therefore, the infectious disease countermeasure, U.S. is not denying the networking. So WHO initially was launched based upon the infectious countermeasures as an organization. So Japan will put an emphasis on the infectious disease countermeasure, and we are going to focus upon the network building that we have strived for, and we will continue to do so. And also, and this is something to lead us to the JIHC and ICDC. But without the global information network, we won't be able to make it happen. So we would like to, in that sense, contribute to it continuously. And it is there are several difficulties. This is not just the easy story at all. And the pandemic treaty, we have got the various kind of conflict of interest, and that is the stark fact. So it's really like South and North conflict. You see, in emerging countries, the treatment drugs are under development, and such as vaccine, and that's been used in the northern part of the hemisphere. But we are not able to come to terms with this responsibility between North and South. So, but we shouldn't give up negatively. But of course, considering the conflict of interest among them, but we need to make a step or two ahead of us that is required to us. So in that sense, we have to be actually involved proactively, and that's what we got to do. Okay, Dr. Wakita, please. As you pointed out, you can say WHO activities are pivotally important to control the infectious disease. And that said, globally, and that said, of course, for the the outbreak of pandemic in the Asian regions, that will affect directly Japan. So all of the adjoining bodies, autonomous bodies and so forth, they know that it is a very important role that's been played by WHO. And at the same time, you see the U.S. CDC has got the major contribution. And as Dr. Moto mentioned, that we are really kind guys, two kind guys. So U.S. is not the member state, but the U.S. CDC is being a part of the autonomous bodies advisory board, and they contributed quite a lot, but they have withdrawn from all of the activities of WHO. So I think in terms of the infectious disease management, we are in struggle right now. But you can see technically and also the scientifically, Japan must be able to play the strong role, and this is a chance for us to pick it up. So that's as you know that maybe polio and extermination has been progressed, and smallpox also being controlled, and we would like to pursue this control scheme, and then in that sense our role has become ever so heavy. Okay, shall we pick up another question from the audience?
Osako from Tohoku University. And GIS has been established, and then Tokyo has Tokyo ICDC, and it's wonderful that this is a panel of experts. However, I live and work in the rural region of Tohoku, and even there are experts at CDC in US, that 50% of the staff are working in the regional cities. So the outbreak responses and also the CDC responses are being executed by this 50% of the expert that belong to the CDC. So the expert who can be involved in the decision making, if they're located in the regional prefectures, local community, that would be very good to reinforce the capability of the local cities, and that might narrow down the gap between the urban cities and also the local cities. So Tokyo ICDC could help and support the neighboring prefectures and Tokyo, Osaka, and they might be able to have a capability of ICDC. However, there are prefectures who need support, who doesn't have a good scheme and mechanism to tackle the infectious disease control. Yes, about the supporting the regional cities and local communities. And do you have any insights and opinions? Dr. Sakoi, please. Yes, it is very important, actually. But we have a FTP national program. The training has to be executed in the regional cities and in the public health and epidemiology. Those will be leveraged in those two areas. And this is a long-term commitment because it is about the personal development. So that is what you were talking about, right? I mean, we had changed a lot of things due to the COVID-19, and there are a regional CDC, and there has to be the basis for the from a legal perspective, and there has to be the budget to support it. And we have 47 prefectures, and how each of the governors are thinking about it, and there might be a difference in terms of the understanding and interpretation. However, and there is, it is sure that the next pandemic is coming, and then there's they have to be thinking about the infectious control diseases for the future. Anyway, so how the gubernatorial meeting, how the multiple governors can work together to facilitate the regional CDC, and also how involving the university, hospital, and academia, because each prefecture has a national university hospital, right? I mean, we can encourage it. However, and we are not a centralized body, and then we can encourage, but we can force them to do that. And of course, Tokyo is a front runner, and each prefectures can learn from the Tokyo's initiative. Thank you. How about Wakita, Dr. Wakita? How about the regional city local community support? What's your feedback? And FTPP. First, let me talk about FTPP. And there are 120 people who received the training program, and that's not good enough. And FETP, after they finish the program, how FETP people remained at the GIS, and I wanted to keep more in GIS. And CDC has, US has more than 100. However, we're not catching up with the level of the US. However, in terms of the number of the public health expert, it is increasing compared to before, and we need to enhance our capability because there is a need in this era, because the NIID has been established in 80s, and then the NCGM has been established, and then to be ready for the pandemic were emerged, and then established a GIS. However, this is the proof of the enhancement of the capability. And talking about the cooperation of the regional community, training and education is critical, but there is no legal support. I mean, and this is the institution that was established only by the notice of the government, and then there is the legal backup now. So when the pandemic occurs, an outbreak of the infectious diseases, and there has to be the scientific base in each region, and the regional, the public health center, or the infectious disease related program and training session can contribute to support the regional initiative. And then I showed that testing network, right? And that's on slide 17. Page 17, can you show it on the screen? And centering around G's, there is a testing network, right? And it existed. But in addition to that, there is a regional network, not only testing, however, the regional council for the disease control, disease treatment, infectious diseases. I think those regional initiative and the program has to be reinforced going forward. And can you show this slide 17? Like Dr. Wakita said, the collaboration in the regional community. Can you show it on the slide? Right, this is the... Can you move forward? Yeah. This is the... And not only the NIID and also the Gs and NIID and NCGM, and it is very important to have the regional, unique, regional specific network. And I am Nagashima from Tokyo University. And in the this is related to the risk communication and promotion and also the personal development. I would like to hear your opinions about it. And we are living in the confusion era in terms of the information. When the next pandemic comes, what would happen to the society? And when we look at the COVID-19, and it was very difficult to achieve one voice communication in doing so, and all problems become intertwined and then making everything complicated. So I think there are communication from various stakeholders, and if there are people who knows risk communication and who can do the risk communication effectively, if those experts are allocated in various stakeholders, the parties, that would be ideal. However, the national government initiative, regional communities initiative, I hear feedback that there are information, but we don't know what to do actually. So they're just, to learn from the model, and they just copied it. So from the your individual perspective, can you share us your insights? Sorry that I always have to ask Dr. Sakoi to state your opinions. Dr. Sakoi, please. Yes. Well, I didn't explain this in my presentation. However, page 5 or 4 in action plan, there is the description about the risk communication. However, next page. However, we had the risk communication session today. I think you have discussed a variety of the challenges. And what I wanted to elaborate on, not on this slide, however, this is a point I wanted to elaborate here. Conclusion first. This is a key to risk communication, because when it comes to pandemic and the regular infectious diseases, and we have to rely on all national citizens to use the facial mask and also to receive the vaccination or use train or not. And the key is going to be information and risk communication and the source of the information and the trust and also the control tower. So to be ready for next pandemic, yes, we're doing a lot of things, but pandemic occurs actually in the future. What do we need to do? And the UK was a good model. And in UK, in terms of communication, dissemination, and the controlled information, that is the area they have focused. It seems like UK's tradition, and we need to learn from UK. And then, of course, and we are learning it. We are learning from UK, but maybe UK has a trust in the source of information. In Japan, to be candid, and we're in a different dimension when we compare against the US. And Japanese citizens criticized a national government always. However, they believe in fake news, and some people at the mass media well, mass media don't talk about the facial mask is not necessary, like fake media, fake information. So the national citizen needs to have authorities to determine what is the most appropriate source of information, so that this is the fact and this is the correct information. Of course, we need to do our best. ICDC need to work best, and then the Wakita sensei, Dr. Wakita, has to work very hard to achieve that.
So, Dr. Wakita, Dr. Narita, can you respond to this question? Yes, thank you very much for your question. Yes, of course, risk communication is crucial. I think that we had discussed a lot about that in the previous session. And how are you going to strengthen this is important for us. Of course, risk communication expert was not there before pandemic period. But after that, we have seen risk communication expert to come in to communicate information easily, which is understandable for the public. So, Dr. Sakoi, and for the MHLW member, I think you have been instructing us really well, and it is on the website as well. So, sending out information easily and setting up a easy to understand website from the peacetime period is something that you have been instructing us. So if you access to the website, it will be able for the public to access accurate information, which eventually will win trust from the others. And can you move on to the slide 21? So GIS is going to send out infection-related information to the other government administration. And then we will also share information to the rest of the society. So administrative information and GIS information should be aligned so that it will become a one voice. And we will make sure that we could deliver a risk communication. And I believe that that is something important. Dr. Narita, please. Yes, awareness campaign of risk communication is something that you have asked, along with the training. In terms of training, yes, we have been delivering training to our officers, and we try to share those training to the other members in other institutions. And I believe risk communication is important, and assessing information after listening to experts' opinion, and then we have to manage that, and then have a dialogue with the resident. So we were told to embrace this 3-week talk, and I try not to forget that. And I think there was a presentation that this dialogue has to be communicated, and we will make sure that the measurement, which has been started during the pandemic period, will be continued, and we will make sure that the information will be sent out to our residents. Thank you very much. I know that there will be a lot of questions from all of you. However, we are short in time. And for those who have been listening through web, I know that you also have a lot of questions. Please send your question to the administration office of this meeting. So we had a lot of discussion here, and we would like to have a final comment from Dr. Wakita.
This is the last part of the debate session, and we have spent the 30 minutes together with all the panelists and the audience, and under the circumstances with our company and also with our Tokyo Metropolitan Government and together with JIHS, GIS, what kind of preparedness have we pursued? You understand fully now. Especially in April, we have launched our GIS organization. So, that still we have the corona epidemic or outbreak, but this organization has never been tested by the upcoming or emerging the outbreak. But as you know, Dr. Sakai mentioned that we will be having the next pandemic. So can we manage the situation better than before? And it's exactly the agenda we are sharing between the Tokyo Metropolitan Government and us. So if we ever encounter yet another pandemic, we must be able to have the better countermeasures. That's we are currently deliberating here, and that is all I need to wrap up. Thank you very much for your participation. Once again, Dr. Sakori, Dr. Makita, Dr. Narita, and Dr. Kaku, thank you very much indeed for your contribution to the forum and discussions.